New plans. Must cover 100% preventative and wellness. New plans are those of you who don't have somebody on your plan today. So don't write this down if you have an active participant. This is only for somebody who buys a contract from a guy like Mike and says, you were very compelling today. I really liked you. I've always wanted health insurance. Can I buy a plan? That claim will have preventative and wellness benefits in it. It will have external independent claims review. It will have pediatric OBGYN emergency care with no pre-authorization rules, which is a state benefit, and it's what Oregon actually added to this bill, so the AHF Merkley. Non-discrimination testing required on insured plans. So you no longer, a lot of employers too come to me and say, really want to cover only 6 people and all those regular people who work here, I really don't want to cover them. How do we do it? Well, we usually create a self-insured plan to get around discrimination, or an insured plan to get around discrimination rules. We can't do that. So we'll change the insured marketplace a little bit with this idea of I have a $2,000 deductible, my self-funded or my insured. So what's effective 2014? No more pre-existing exclusions. No more can I say if you had this before you came on the plan, it's not covered under our plan. This is a big boon to individuals. And it's a kind of a crappy thing for employers because it costs a lot too. If they have a pre-existing exclusion, it's usually like an ongoing problem. It's costly. This is the person that comes to your office and says, I've got this problem, I've had it forever, I really need to be on the insurance. Maximum waiting period is 90 days. If you take people 6 months out, now it's only 90 days, you've got to let people in. Grandfather plans, that's going to be a change that's going to happen in 2014. So all of you sitting here, you may well have to do all of the things I said on the prior slide, 1/1/2014. And we're actually a lot closer to being done than you think, so for about 10 minutes. Because the reporting of penalties is really simple, it's just complicated to listen. So dig in for about 3 minutes and you'll understand. Step 1, 2014 tax year. Penalty on large employers, that means 50 or more. So if you do not have 50, stop listening, stop worrying, stop concerning about it. You are exempt from all penalties in this bill. If you're under 50, no penalties reporting. At least one FTE enrolls in exchange, which is 30 hours per week. So if you have over 50 employees, and you have at least one individual who is working 30 hours or more per week, and they enroll in the exchange, meaning they don't buy your health insurance. They go buy their own. They receive a premium tax credit, which is based on poverty level. And they do not get a free choice voucher, which for this presentation, don't worry about what that means. So 50 employees, one gets on the exchange, declines your own health insurance or you don't have it, and has a poverty limit which is dramatically lower than you probably all think it is. It's like 10.7, I think. Then they have potential penalties. So employer 20 employees, 20 full-time, 8 part-time, 10 individuals participating, no mandatory coverage penalties for reporting. If that's you, you don't have a problem. You don't care about step 2. However, I do, so we're going to keep going. Employer of 58 employees, 51 full-time employees, 7 part-time. All are eligible for the health plan, 10 individuals participate. You must provide health insurance to full-time employees to avoid the penalties. So we all clear on that? Small, big. Who's clear on that? We'll raise our hands. Who's not wants me to do it again? Who wants me to finish by 9? Okay. Reporting and penalties, step 2. At least one full-time employee enrolls in that exchange and receives the premium tax credit. So again, how many employees? 50. At least one gets into the exchange. At least one gets the premium tax credit. Premium tax credit is a refundable tax credit for individuals and families. It's a credit, it's a real, everything in this law is complicated algebra. If you didn't do well in algebra back in Hill High, like Brandon probably didn't, then you really can't figure out these things, and that's why you need this anymore, somebody else smarter than me. Federal poverty levels 10.383. Basically, for your purposes, if you have employees earning less than 40 grand per year, you may well have an issue. Only available for taxpayers who are eligible for Medicaid employer-sponsored insurance, meaning they have to have something else they can buy. Instead, effective 2014, this is pay or play. If you don't offer good health insurance and somebody chooses something else and the government has to pay for it, we're requiring you to pay a penalty. So example, 58 employees, 51 full-time, 7 part-time, all are eligible, 10 individuals, 1 full-time employee making 15 grand a year, which is below 4 times the federal poverty rate of 10.7. That person declines your company health insurance and says, I think it's crappy, I'm buying something else, and purchases on the individual market, you may have to pay a penalty. Now guess what? The government really doesn't care whether you pay the penalty or not or have health insurance. Because they're going to tell you you only have to pay $2,000 or $3,000 per employee, depending, And I guarantee you, when I said my $250 per year example, if I said now, how many of you pay less than $2,000 per year for insurance, you'd still all say that's cheap. And if you think the government's not trying to get to single payer health insurance, why calling it employer mandated health insurance? Because that's what a good Democrat wants, you're crazy. The government wants you all in single payer health insurance. And they want you because they're going to go to every rational employer and say, you pay far less than $2,000 per year. Let's talk about the penalty. So if you have a group health plan, you have 50 or more employees, one is at the poverty limit, one declines your coverage, and one buys on the exchange, you pay $2,000 per FT. In my example, you didn't have a health insurance plan. So if you said today, no more health insurance, I don't care what you do, your maximum exposure is $2,000 per employee, less the first 30.
So is that just full-time employees or?
Full-time
do you
employees.
have to-
Well, you do have to aggregate as well, yes, so full-time employee equivalent,
That's just.
yes. So that's it, that's the maximum you'll pay. If you do have a healthcare plan, you only pay $3,000 per employee who goes and does it, which is even probably cheaper. So again, in my example, you don't have health insurance, you have 50 employees, somebody qualifies for eligibility, and they buy the insurance like they're forced to. So you don't have a health insurance, you know they're gonna buy it, you're gonna owe $2,000 per FT, and you know that now, and you should write it into your forecast and say, that's my maximum health insurance exposure, because I don't care about health insurance beyond that. And if you do, and I say, oh my God, what's gonna happen to my business, what's gonna happen to my margins, you say, how many people are at federal poverty level, and even if they all decided to decline my insurance and bought it, I owe $3,000 on top of what I pay now. Yes?
So isn't that gonna be an incentive for most people to try to cut down to 49 employees in one safe way?
Oh, yes. You're gonna see a lot of contract employees, a lot of seasonal employees, and a whole lot of employees that are mandated to work 29 hours or more or less. Absolutely. Anybody that's close is gonna knock down. Or you're gonna see companies like PEOs, and probably a lot of the same people are saying right now, say, well, if you send them over to me, you don't have that problem at all, so knock yourself out. And you'll just pay the health insurance cost. Yes?
Is there a time limit as to how long you can classify employees?
Well, no, it's not a time, seasonal is not a time limit issue, it's a functional facts definition. So I'm gonna look and say, when are they working, how are they working? And really, seasonal is mostly addressed in the 401k regulations, and it's gonna be addressed with how much I'm working typically over a 3-month period. So that's likely what it's gonna be. So example, 58 employees, 51 full-time, 7 part-time, all are eligible. I've got 50 employees, 10 are in it, 1 full-time employee making the same 15, declines the insurance, I owe $3,000 for that person, and that's it, plus whatever I pay for health insurance. The flip is, I have those same people, I don't have a plan, I owe $2,000, and in my example, that's $42,000. $2,000 for the full-time employees, less the first 30, and I didn't get into aggregation just to make this simple. So to follow the math there, I've got 58 employees, 51 full-time. I take away the first 30, I now got 21, I owe $2,000 times 21, that's $42,000 a year. If you said, I don't want health insurance, I want to know what my forecast says, you can put 42 grand in your health insurance line, and if that's cheaper than your current line, you made a good deal. If money's all, if the bottom line's all you're worried about. Private equity companies, big public companies, people that are looking to sell in the future, they will care about EBITDA, earnings before income tax, and they will say, whatever the next person does, it's fine, but right now I want to bump that multiple as high as I can. So you will see a lot of private equity mid-range companies dropping health insurance. Because it will improve the bottom line. And if you don't like working here, you know what, go find a job in this economy. That's a tough position. But it's exactly what's going to happen. Things don't get better. But one saving grace, can I ask you a question a second? One saving grace is, our workforce is aging incredibly, and it's going to be a lot harder to find workers in about 6 years than it is today. Yeah.
So the one in full-time employee making 15,000, you don't have to pay 3,000 on that one?
No,
Okay.
just the two. It's all based on, do you have a plan or not?
Okay.
If you have a plan, you're in the 3,000 category. If you don't, you're in 2,000.